Rock and roll, people. How are we all going? I'm really excited to jump on today because I get asked the question time and time and time again, and from different people in different places, different environments, and that question is, what is med school actually like? And so I thought I'd jump on and just talk about my experiences and what I've been through, because then hopefully it'll provide a little bit of context of what med school is like. I'm currently heading into my sixth and final year of med school. So I've had 5 years, half a decade of this journey in medical school. And maybe if I provide context, then that might help some people decide whether they may want to go to med school or maybe not. But it just provides a little bit of information about the journey. Obviously, this is my own experience. Other people experience med school in different ways, but this is a little bit about my journey in med school. So first thing I'd say is it was quite a challenge for me to actually get into medical school. I got in on my fourth application, so I didn't get in after my first year at uni. I applied postgrad in New Zealand and didn't make it after postgrad, and then I sat a test called GAMSAT, which would, if I did well in that, then that would have allowed me to go to med schools in Australia, and again didn't do well enough in that one, so I had a bit of a break from academia, and then I applied to the alternative category in Otago University and managed to get a place in med school from that. So it was probably up to that point a 8-year journey to actually from when I was thinking about getting into medical school to actually getting accepted. So there's quite there was a long build up towards this, and there were times when I was thinking about med school. There was times that in there that I wasn't thinking about it, but in the end I applied and I successfully got placed. So that's the first thing I'd say. Everyone has their own journey to actually make it into med school. So if it's in your mind that you want to go to medical school and become a doctor, then just try again if that's the thing that you actually want to do at the end of the day. If you don't get in on your first go, then try for your second go. Just try and jump through the hoops that the medical schools require you to jump through, and then eventually you might get a place. Nothing's guaranteed, but if you don't try, then you're not even in the running. So that's the first thing I'd say. But when you're actually in med school, what is it like? So Otago has two halves of the degree, I suppose. So the first half is called ELM, which is Early Learning in Medicine, and then the second half is ALM, Advanced Learning in Medicine. And I suppose to put it very broadly, the first half is more focused on theory, and then the second half is more focused on the practical side. Although you get a little bit of practical in the beginning when you're like learning the clinical skills. You're not interacting with patients as such, but you're learning how to take a history and how to examine patients, and you're sort of building that little bit of practical foundation. And then there is theory when you're in ALM, the second half, as well. So you're going to lectures, you're learning the sciences, but you're thinking very broadly, those are the two focuses. So ELM, for me personally, I found it quite challenging. I wouldn't say it's a walk in the park for anyone, but when you jump into the environment, you're getting fed a torrent of information. You have to learn the language of medicine, you have to learn the science of medicine, you have to learn the ethics of medicine, and this is pretty much what the first 3 years of med school is like. So you're going to lectures, you're going to labs, you're going to tutorials, you're put into groups and you're learning alongside these groups, and you're interacting with your classmates, and in your lectures you'll learn all the basic medical sciences, so anatomy, learning about where everything is in the body. You'll learn histology, what happens inside cells. You'll learn pharmacology, so that's what drugs do, I suppose. And then you'll learn immunology, how your immune system works and how you fight off illnesses. So there's all these different things that you have to learn and jump through. And there's also different body systems. So you'll go through neuro teaching, how the brain, spinal cord, and nerves work. You'll go through cardiology. So how does the heart actually work, and the cardiovascular system work. You'll go through the respiratory system, how your lungs work. So also the GI tract, how you take in energy and eat things and protein and all the rest of it, and how it gets moved around the body so that you can function as a human. So there's all these things that you have to learn about, and that it's there's a lot to learn, right? And there's no shortcut around it. You have to actually spend the time in the environment and try and compress all this information. And at the start, the reason why it's so challenging is because it's almost like they're speaking another language. And when I say they, as the lecturers and the tutors, you have to learn all this jargon and try and piece it all together and how everything works. And it's like having like if you're building a puzzle and the puzzle is like the full knowledge of medicine, you're getting drip fed a puzzle piece at a time, and you can't see the full picture until you've got more of the puzzle pieces, right? So you might learn a little bit of immunology and you don't quite understand how it fits in with microbiology, and then you'll learn a little bit about cardiology, but eventually the puzzle starts to take shape, and you can actually start stringing things together and understanding why disease processes go in the way they go, and how genetics plays a part, and how why doctors do a certain clinical examination, or why they ask a certain question during history taking from a patient. So you sort of build up this knowledge base, and the first 3 years is to give you a basic understanding of that broad knowledge base, right? So that when you get into your following 3 years, then you can actually take that knowledge base and you'll apply it in different specialties, right? So the first 3 years is just learning the academic knowledge and trying to synthesize it in your brain, so that then when you get to your last 3 years of med school, you can actually talk the talk with the clinicians and the nurses, and you can actually start stringing things together. So first 3 years, basic sciences. Next 3 years, you start your placements. You get to go into hospitals, and the last 3 years is really interesting because you have 8 weeks generally of a specific specialty. So you might be on cardiology for 8 weeks, or you might be in pediatrics for 4 weeks, or you might be in psych med for 8 weeks, and you get to be in these placements for a given amount of time and learn about that specialty. So it's quite you learn the basics of that specialty, and then throughout that time, if it's 4 weeks or maybe it's 8 weeks, you go to tutorials and you learn the specific skills with that specialty, and at the end of the run, you'll have tests on it, and throughout that run you'll have assessment. So it's quite gung-ho, because when you start a specialty or you start a run, a lot of the doctors will challenge you. They'll ask questions of you about that specialty. So maybe you're on orthopedics and you'll get to go to surgery for orthopedics, so you'll get to see broken bones and stuff, and how they operate on broken bones, and they'll ask about the anatomy of that body part, and while they're in theatre, and they'll try and test your knowledge, and you'll have to try and remember back to your teaching in ELM and try and apply it to the patient in front of you. So and a lot of the time you're new to the specialty, so there's a lot more knowledge that goes with that specialty than you've been taught in your previous years of medicine. So they really stretch you, and you'll have tutorials along the way within that specialty so that your knowledge grows over time. And then at the 8-week mark, there'll be a test, and that's generally an OSCE, which is when they get to check your practical skills. And there's also a theory test, and there could be assessments along the way. So maybe you have to do a logbook and show that you've interacted with patients and understood certain aspects of those cases. Or there might be a patient interview that you have to record, or there could be a raft of things. You might have to show a growth chart for pediatrics. So there's a bunch of things that they make you do, so that then you get a deeper understanding of that specialty. It won't make you a specialist, but you'll understand the broad concepts within that specialty. And we get rotated around these different specialties every 4 to 8 weeks. So and because everyone is placed in different groups, they're rotating through their runs at different times, everyone within your cohort has a slightly different understanding of each of the different specialties, because some people have done it more recently and some people haven't done it yet. So you can ask your mates within your cohort about what a certain specialty was like, or what knowledge did they learn. And throughout your degree, you get to build up this knowledge base and get to interact with each other. And everyone has a slightly different experience. That's just the nature of medicine, and they may have seen different cases, and so you discuss different cases with each other and see what you saw and how did different clinicians treat a certain patient in a certain way. So over time, you get to broaden your understanding. You get to build up that puzzle, per se, because you have more puzzle pieces to put into the picture. And then at the end of 5th year, you have a big test, or you have multiple tests, actually. You have your big exams, which is, they can test you on pretty much anything from the degree, and it's quite broad. But then we've also had our pathology tests, so that's microbiology. We've also had tests on hematology, pathology. So there's all these tests that go with 5th year. 5th year generally is the hardest academic year of the degree. The 6th year is more learning the ropes and practicalities behind being a good junior doctor. So will get put with the teams more and get to actually work with the team, so that then you get to learn more of the practical side rather than the theory side. And you'll always be learning the theory side as well, but the focus changes slightly. So that's the year that I'm heading into now. I'm really excited for it, because we get to actually work more alongside clinicians and do the things that we'll do once we're qualified, while still having the oversight. So we'll have a lot of the excitement that comes with being a doctor, with a lower amount of responsibility compared to when we're qualified. So it should be a good year. If anyone has any questions about med school, what's like, if you've got any specific questions that I didn't really jump into, just send me a message, or comment below, because I'm always happy to help. There's been a few people over the years that have reached out to me to ask me questions about med school, or how to apply, or things that they should do, and I'm always happy to help those people, because I remember when I was going through the process, some people helped me along the way. So yeah, that's me. That's what med school has been like. It's a wild journey, and it is challenging at times, but it's well worth it if that's what you want to do. It's it's pretty epic what we get to see and do. Some of the surgeries are wild. There's a bunch of medical conditions that generally you don't see unless you're involved in healthcare, and just how we can help people in specific ways in their time of need is pretty unique as well. So it's a really privileged place to be in, and you don't get experiences anywhere else apart from in healthcare. If that's what you're into, you can help people in a range of different ways, but healthcare has a unique a place in the world, I feel, because everyone needs their health. So that's all from me. Like I said, I'm always happy to help those who are interested in healthcare or in medicine. I'm not a fully qualified doctor, but perhaps one day I will be in 1 year's time. Awesome. Okay, that's all from me. Hit me up if you have any questions. Hope everyone is doing epically. We'll catch you on the flip side. Bye.